After more than 6.8 million Americans received the Johnson & Johnson vaccine, federal health officials now say it should not be used pending an investigation. Officials say there have been 6 reported cases of blood clots out of more than 6.8 million doses delivered. All 6 cases occurred in women between the ages of 18 and 48, and their symptoms developed 6 to 13 days after getting the shot. Local officials say there is no reason to worry.
In truth, this was a 1 in a million side effect. Now, obviously very serious, and we want to understand more about it. But I do want to remind people that that association doesn't equal causation. Right now, we have an association that we need to understand. We need to see if the vaccine was in fact the cause of these side effects.
Christian Garzone will join us live to talk about the impact this is having on vaccine clinics in Monroe County. But our team coverage begins with Kayla Green, who spoke to doctors today about this rare condition. Kayla?
John, as you just heard there from Dr. Mendoza, doctors today are saying that this is quite literally a 1 in a million event. Now, anyone who got the J&J vaccine in the past 3 to 4 weeks is advised to monitor for symptoms just in case. But Dr. Mendoza says the chances of getting COVID-19 are far greater. Now, Dr. Ed Walsh from Rochester Regional Health says the evidence showing this clotting issue is affecting primarily people under age 50 with low platelet counts. He says the 6 patients with these rare blood clots have experienced persistent headaches and abdominal pain. He says, unfortunately, headaches are common in both vaccinated and unvaccinated people, but the CDC recommends people who have received the J&J to monitor symptoms carefully. Dr. Walsh also emphasizes these blood clots have occurred in close proximity to each other, and people who were vaccinated months ago appear to have no risk. He says it's common to be in this position with a new vaccine or medication, and the FDA keeps track of small, rare side effects. The CDC says this pause may only last a few days. Dr. Mendoza says the vaccine is being paused out of an extreme abundance of caution, and we still need to figure out if the shot actually caused the clots.
There is a good possibility that these women might have developed the blood clots even without getting the vaccine. We just don't know, and it is prudent to examine what might have happened. This should not be viewed as a reason to not get vaccinated. The risk of serious illness or death from COVID-19 for you or a loved one is higher than the risk of serious illness or death from the available vaccines.
I wouldn't lose any sleep over it. I would pay attention to symptoms and not ignore them should you have them. And I think that the rarity is something that I think should give most people reasonable reassurance that they'll be okay.
Dr. Mendoza says the county is working to reschedule people who were scheduled to receive the J&J to instead receive the Moderna or Pfizer if they're interested, and he says that they will keep everybody posted as they continue to work on that. He says they had no plans to give the J&J this week, and anything that was left over from last week will be stored. Live in Rochester, Kayla Green, News 8.
All right, Kayla, thank you. Team coverage continues with Christian Garzone. Christian, SUNY Brockport was scheduled to hold the J&J vaccine clinic today. How has this changed their plans there?
Well, John, like many have said, the J&J vaccine dose is one and done. That's why some SUNY schools, including Brockport, decided to go with that for students. But Brockport is saying for the time being they want to let researchers do what they have to do and find out what they need to find out on the J&J vaccine. In the meantime, they say they are going to explore other options. John Falaco with SUNY Brockport says they heard about the FDA's pause on the Johnson & Johnson COVID vaccine this morning. He says for the student population and the community, it is a setback, but he says so many are still looking forward to getting vaccinated and getting back to normal. He says they are currently pursuing other vaccines like Pfizer and Moderna. We don't know how long this pause will last with J&J, he says. Like many others are doing, he says the best move right now is to stop and let researchers do what they have to do, but the plan is to still get everyone back in the classroom next semester.
However, they understand that the health and safety of our community has been at the forefront of our plan since the very beginning of this pandemic. I mean, it's always at the center of what we do. So I think they were appreciative for us taking the cautious approach here. However, they're really excited to get vaccinated. There was a strong interest in our vaccination clinic. We're trying to make folks aware of other opportunities. I know Monroe County has some appointments available. The folks that I'm hearing from have been resourceful. They're reaching out.
At this point, a vaccine mandate at all 64 SUNY schools has not been decided upon just yet. From SUNY Brockport's downtown campus in Rochester, Christian Garzone, News 8. John, right back to you.
All right, Christian, thank you. The chancellor of SUNY Schools releasing this statement today saying, quote, "We are working with New York State to locate and receive alternative COVID-19 vaccines for our students. We urge all students with appointments for the Johnson & Johnson vaccine to contact their campus or vaccination site because alternatives have already been found in some instances," end quote.